New research appears to show that COVID-19 may not be spreading through schools as much as anticipated.
However, health data from Georgia shows school outbreaks. Those are still a major problem and a concern. CBS 46's Barmel Lyons explains how Georgia stacks up against the rest of the country. Barmel?
Yes, that's exactly right, Rick and Tracy. According to this new COVID-19 response dashboard, it's attempting to map out just how COVID-19 is spreading across the U.S. in schools. I speak to a local doctor who compares the numbers.
The public needs more transparency into the school data.
A new national effort asking K-12 schools to voluntarily and anonymously report their confirmed and suspected coronavirus cases.
And when we do look at the data, it is optimistic. It is promising of the data that we do have. Those infection rates are lower than we anticipated. And again, those are of students that are getting tested.
The COVID-19 school response dashboard showing early data on COVID-19 in schools is better than expected. Data taken from the last 2 weeks of September from more than 200,000 students attending school in person from 47 states found an infection rate of 0.13% among students and 0.24% among staff. Despite the encouraging findings, data from Georgia's Department of Public Health shows schools are still a major factor contributing to the spread of the virus. In fact, it's the second highest setting where the state is reporting outbreaks, only behind nursing homes.
If you look at the Georgia school data that we have that's reported, the percentage positive is actually a little bit higher in Georgia than the average in the rest of the nation.
Dr. Bouillon says it comes down to an issue of transparency in data and says the need for careful monitoring of what the community is doing to minimize the spread of COVID-19 is necessary.
I do have optimism looking at the data because what it also tells me is that we don't have to wait for a vaccine to have schools operating. We can have schools operating safely without a vaccine as long as we're taking strict precautions.
And Dr. Bouillon goes on to say that tracking the use of masks, social distancing, and other PPE protocol will be essential in learning some more. In Atlanta, I'm Barmel Lyons, CBS 46 News.